All right, well, it's James Lunday and Alan Bauman from the Arc DFW area. Here once again, wrapping up day 2 of the Disability Policy Seminar here in Washington, D.C. So just wanted to share a few notes from our day today, a little bit different schedule, a little more separate. So we had we split up and did some sessions today. But, started the day with actually a couple of political consultants. To kind of advise kind of what's going on in the Hill, some inside knowledge. I thought that was really informational.
Very, very informational and um, more more specific to um, just appropriateness of certain questions and attitudes, and um, be more be more cordial, build those good relationships. Because if you stay too long, or if you make them mad, if you challenge them, fight with them, then you're not going to get back in there when you really need to, when it's time for them to vote on the bill. And they're probably going to say, no, but I don't think I'm going to support that.
Yeah.
Those people.
Yeah.
So that was really important.
Yeah, that's kind of one of the takeaways I had too, is that you hear it's like, well, it's not a done deal yet. And a lot of that means we talk about from, oh, we can still change the process. In reality, I think a lot of it is there's just so many more details that, to your point, you want to be there when they actually get to the details, and not, I think one of the things the consultant said is, don't just automatically go to the worst case scenario, which is easy to do. Obviously, those of us live in the community, we hear the top line numbers. It's like, yeah, it's very, very fearful, a lot of concerns, but at the same time, we've got to think about, okay, well, because you're going to end up in a situation where, like, well, we're not going to cut Medicaid for you, or we're not going to, take away your benefits, but they, you don't, you're not to that point yet. And it's like, well, try to get to a point where you can educate them. Well, you see, when you get to this particular policy, this is how that's going to affect me. And you want to be able to have those conversations.
Right. Because at the beginnings of the things that we're really stressed about the most right now, there are no details available as far as, and for them to make a bold statement like we're not going to touch Medicaid, or we're not going to touch Medicare, that scares me, that they would even make that statement, because they really don't know.
Right. But I think that's too what those guys talked about was, just being able to talk straight is right. When they come to you and say that and say, well, we're not going to touch that. It's like, okay, I get it. It's not in the current bill, but everybody's talking about it. So let's not act like it, it's not on the table. And I think so, trying to call them on that and make sure you can have a frank conversation, but do it respectfully.
Right. But you don't want them to just blow you off, because you're there on your time with very important information to share, and you just have to, like you say, respectfully manage to at least tell enough of your story that you can say, this is what would happen in my life. Right.
Yeah, I think that's the thing. We're experts in our story. We're not experts in how legislation works, how budgeting works in the legislation, especially. So very important for us to stick to our wheelhouse and to be a resource for our expertise. Right. And then it's on their staff to make sure that they stay in communication, make educated decisions.
And like they were saying, don't start with the numbers, because he made the example of, $880 billion cut would be the same thing as eliminating 22 states from having any benefits. Well, they're not going to do it that way.
Right.
And that somebody might use that just in a point to talk about how big it is. Yeah. Or if that happens, if those cuts happen, then that would mean, 300 million individuals would lose their services. Yeah. And we know those things, but it's in the time yet to talk about that. It's just try to explain the ripple effect again, like we were talking about yesterday. How many agencies it affects, even like the agencies that are funded by federal grants to represent and to help people with disabilities. that's part of it too. That would go away. Their jobs would go away.
Yeah.
So it's not just the impact specific to
Right.
Medicaid or Medicare, and it's hard to be specific with Medicaid because Medicaid touches so many things. It touches everything.
Right. Yeah. Yeah. So it's like, again, yeah, it's kind of brings it back to, we can try to like extrapolate and communicate beyond, but you get out on our skis and then we can't really back up what we're saying. We can always back up our story and our experience. Nobody can take that and tell us that's not our life. Right. So that was the morning. So then we shifted in the afternoon, did some different breakouts. I know we actually both were there for part of a session on IDEA and what's going on with that. So that and the changes in the Department of Education. So so there were some interesting pieces, obviously, around that. What from your time in there, what stuck out to you in that?
That there are other things that I didn't realize are impacted by IDEA, really not just education. There's some other things that would be impacted by that as well. And there's always something new to learn. That's what really impacted me. And I'm going to do some more research on that myself.
Yeah. And I was there when they talked about the changes in the Department of Education, and there's obviously been a reduction in 50% reduction in staff there. There's been eliminations of certain groups. A couple of things that stuck out to me is that the Department of Education has had specific teams that were like almost like disaster response teams. So if there was a big weather event like a hurricane or something, and so the schools were out of service, well, those teams could be dispatched and help the schools. And how that would help us is they would make sure that students with disabilities, that their needs were met. They didn't get lost in the shuffle. Right. Same thing with school shootings or other just mass events.
They didn't get left in the classroom and forgotten.
Yeah. And so a lot of those groups have been eliminated. So that's, one of those things you don't know what you need until you get to that point. And I think another thing they talked about is in the shifting of special education, the idea of moving that to HHS. Person brought up the fact that it's like, well, that moves it back to being where disability is in a medical purview, a medical model.
Right.
And historically, what a medical model for disability means is institutionalization. And so now you're out of a community-based model, setting, and you're in the bounds of a medical treatment. When in reality, disability is a lot more than medical issues. There's a lot of issues there. So those are the kind of the key takeaways. Obviously, there's a lot of stuff going on in the Department of Education, a lot of stuff that's ground covered there, and stuff in the courts and things like that. But those are the things that stuck out to me the most.
Yes.
So then we went. I know we did split up on the second one. So you had the opportunity to go to a session on the direct support professionals.
Yes.
And
and that was, I was pleased to see that most of the people in that room, and the room was standing room only. Every chair was full. Most of the folks in there were professionals, and they are trying to form a cohesive group so that they can make it even more professional and to provide more trainings, have a certification available. And by the way, I was in a meeting this afternoon, or this morning, on the same thing at the Texas level with Health and Human Services. They've reactivated their workforce on the direct professionals for the same reason. Of course, money is the number one thing. These people need to be paid an appropriate rate of pay for their work, because it's not just somebody that you could just have walk in the door and know that they're appropriate for that position. But the rate of pay Texas gives them right now is about $10.30 $30 an hour, and they're trying to move it to $12.44 an hour is what the committee has suggested. We were hoping for more like 17, which is what the State Supported Living Center attendants get paid. But for 10 or 12 bucks an hour, our best attendants, they have to take care of their family too. Some of them have to leave and go to Buc-ee's, and they get $16 an hour plus benefits. So I'm glad to see enough support gathered to help us appreciate them or show them how much more they're appreciated. Your situation and mine both, we've been very careful about who we trust to leave with that most important individual in your life, that loved one. And if this all comes together like they're trying to do, especially the Texas work group, because they're taking it further. They have a website already, and it's designed for candidates as well as for people like you and I who would be searching for an attendant. And there's through that you could get their information before you really even contact them. One of the changes that we realized hadn't happened yet today, but they would be able to put in your zip code and find people. But there'll also be training that will help them be familiar with the job description. And the job turns out to be way more than those things that are just listed on the prescription, just because the nature of the disability that individual has and what their basic needs are. I know I once heard it summed up really well when we first were able to get those services for Kayla to get attendant care, and that person who came from the state sat there and said, "Is anything that she would do for herself if she did not have her disability and lived independently, that would be the job of the attendant." So it's pretty general.
Yeah.
But I think it's an important move. We need to support them all we can, and to promote them all we can. And of course, everybody listening to this, please call your local legislators and tell them that they need to raise those wages. And
Yep.
They know they need to. They know that's not a living wage, but the more of us that they hear from, then maybe it will begin to take a front burner place, because this has been going on for 30 years. Some of those wages haven't been increased for 30 years. So that's really important to that direct care people. And we've even asked Health and Human Services to get bolder. They don't set the wages.
Yeah.
Legislator sets the wages, but HHSC, they give them an ask of what they need their budget to be.
Right.
And I just asked them to crank it up.
Yeah. So, and then I was in a session on opportunities and challenges around Social Security. Obviously, there's a lot of stuff around there, a lot of things, try to be hands off, but there's been, obviously, with the government efficiency efforts, a lot of, interest in that group and changes. Some are, seen by some people as positive, some not. Big piece I think that affects us is really expertise. And there's already a challenge, a lot of people with disabilities getting qualified under Social Security for those benefits. And so really the groups that are in charge of the complex cases or the resources that frontline people go to when they have complex applications, those groups have been directed to have significant reductions in force. So while there's no evidence yet, I mean the natural response is that those cases will just extend time. There's already I know a number of cases where it's over 200 days. Where before people get approved for disability services under SSDI. And so, some people, unfortunately pass away before they can even get benefits because they couldn't get those benefits. So, So that's certainly an element there is very critical around Social Security, and so but there are a couple of there's one bipartisan bill that the ARC is supporting. We're going to put some more information out that about raising the asset caps.
Right.
So that's in process. So there's an opportunity there. There's also an opportunity. There's a bill that's been presented to eliminate the marriage penalty.
Yes.
So that's another important thing for
We
people
had
with disabilities.
self-advocates even speak about that
Yeah.
in our last session.
Mhm.
They
Yeah.
can't afford to get married because then they would lose their benefits, and that doesn't mean that their disability goes away.
Right. Right.
It's just
Yeah.
never mind.
Yeah. Yeah. So so obviously a lot to cover today. A little bit longer video, but just also tomorrow we'll be on the Hill, and then there we'll be visiting. We know the senator's offices, Corner and Cruz, making some visits to representatives. Well, there's about 9 of us from the state of Texas here, so we'll have an opportunity to get around and stop at some offices before we fly home tomorrow evening. So maybe we'll get another recap in of that experience tomorrow from the airport or something. And then also, though, I just wanted hopefully, people that are watching this, you saw our communication about this Saturday, 2 to 4 p.m. in Frisco. We're having another disability policy summit for the DFW area. Certainly, be able to share some of the details that we got this week. Also, we'll be getting some more details around what's going on in Austin during the session down there. So if you can make that with your calendar, we'd love to have you there and get you plugged in more to our efforts. So one of the things we closed with today is that disability isn't partisan. A lot of our issues they are political because we're in a political operation, but it doesn't mean they have to be partisan. We're just we have humans, we have needs, we have rights, and we're advocating for those. So with that, I guess we can close out, and we'll talk to you hopefully tomorrow.
Take care, everybody.